This is Ayavale Immaculate, the pharmacist at Lifeline International Hospital. I'm going to discuss with you about self-medication. So, first we shall go through the definition of self-medication. This is taking in a drug without the physician's advice about the drug you're going to take or the treatment. So, we highly discourage this because it leads to various problems like dangers. You may incur even much costs, but mainly why we discourage self-medication, it is because when you do self-medication, mostly you come up with a misdiagnosis. Like most people treat themselves and someone is managing stomach ache, maybe it is caused by food poisoning because you have not come up with a full diagnosis. You're just treating something on top, but you've not found out what really you're treating. Either it could be food poisoning, it could be PUD, and people just treat. They do not come up with the right diagnosis. So we discourage this because it causes you come up with the wrong diagnosis. So it's advisable you visit a physician and they give you the clear diagnosis of what they are going to manage or treat. Then another point can be about having a wrong treatment. Mostly people, when they feel headache, everyone runs for paracetamol. You've not found out even what is causing that headache before you take the paracetamol. That's why we advise, before you do self-medication, seek for a medical officer and health worker to advise you, because this headache may be due to malaria. Of self-medication is drug interactions. These drug interactions, they are the dangers that come in when you take two drugs at once and without the medical officer's advice. So, for example, when you take metronidazole and you take alcohol, it may result into death. So if you've not sought the physician's advice, it may cause death, and you're bringing problems to your relatives, problems to your sisters, your siblings at home. Then another thing, when you do self-medication, you may lead to severe, you may cause the condition to be severe. If it was malaria and for you you're maintaining paracetamol throughout, you're not even seeking medical advice on how to take the antimalarials, you may develop cerebral malaria. So it is advisable you seek medical assistance in such conditions. Some people even they end up taking the drug incorrectly. That's what we call improper drug administration. Instead of swallowing, if it is per oral, someone is just chewing it, actually mainly like pessaries. Some people, sometimes they swallow the pessaries, and these are not supposed to be swallowed. So that's why we advise, as Lifeline, we come in today to advise you to always seek medical assistance. Here at Lifeline, we have all the physicians